Hi, this is Taryn Grome, editor of Pharma Voice. We met with numerous inspirational thought leaders at this year's DIA annual conference as part of our Editors Take video series. I hope you enjoy this discussion.
In this episode, we meet with Larry Florin, clinical leader, life sciences R&D practice, Cognizant. What are code halos, and how are they transforming clinical development?
So from a digital clinical perspective, we talk about the things that are used by clinicians and patients to monitor their own health and well-being. And the more the technology becomes available, the more that becomes embraced. So people are able to basically diagnose, treat, manage their conditions, whether it's diabetes, whether it's hypertension, any number of indications now are being, falling under this umbrella of digital clinical. From a cloud halo perspective, then take this one step further. So think about what one does every day of one's life. You basically go out, you do online banking, you make credit card transactions when you buy things online, you chat on social media. Each of those elements leaves a little bit of a breadcrumb that talks about you and provides a sort of umbrella of information about you, your own digital fingerprint. And we at Cognizant call that our digital halo. How does that translate? There are enormous potential benefits of collecting these data and harnessing the power of that information to help you on your daily life.
How does the code halo benefit clinical research?
So I think one great example that's very pragmatic is that think about collecting this information in a timely manner and reducing the workload on investigators and patients. So instead of having a patient return for a visit the way we do things today very conventionally, instead you have these mHealth devices that can collect data on a continuous basis. So you obviate or reduce the need for that presence. And so all the monitoring can be done electronically, uploaded into the clinician's database, ultimately into a sponsor's EDC form, and that information is collected and gives a whole new outlook in terms of how data are collected, the timeliness, and the data quality.
How does digital clinical technology impact clinical data analytics, and what are the benefits?
I think the best way to consider this is that we amass large amounts of data. So essentially we come into that big data conundrum. So all of these devices collect a lot of data, and it's being done on a continuous basis. So what you really have is a lot of information. The key ingredient now is to figure out how to analyze that, how to take advantage of that and make sense of those data. So what we really need is the collective expertise of lots of people, a multidisciplinary approach that takes a look at the data, figures out ways to explore it, understand what the questions are, and then use great analytics and technology tools to help us discern and really ask the right questions and then pull out and tease out the right information.
Once you collect and analyze all of the data, what do you do with the results?
So I think the utility of that data, of those data, are to really help better plan, better anticipate, and proactively look to mitigate potential problems that occur during the clinical trial program. So you can inform better trial design, you can do better feasibility, you can proactively mitigate and preclude challenges from happening as the signaling detection capabilities increase and ever improve. We can use these triggers and thresholds to improve data quality, reduce cycle times, and make the overall clinical trial process even more improved and better optimized.
For more information on this topic, visit our Thought Leaders website.
For more Editors Take videos from the 2015 DIA annual conference, visit www.pharmavoice.com. Thanks for joining us.